5 million children die annually before their 5th birthday from preventable illnesses. Respiratory distress is a leading cause. With appropriate care, many of these babies can be saved. Bubble CPAP is a highly effective treatment for respiratory distress, and Vayu makes it accessible to babies around the world. The Vayu bCPAP system is the first low-cost, high-quality newborn and infant CPAP system that does not require electricity, compressed air, or advanced bioengineering support. The Vayu bCPAP system uses an external oxygen source, such as a wall source, oxygen cylinder, or high-pressure oxygen concentrator. From the source, oxygen tubing connects to the Vayu blender. The blender innovatively blends pure oxygen to an adjustable concentration with atmospheric air by the Venturi effect. This ensures the patient does not become hyperoxic and helps prevent consequences such as bronchopulmonary dysplasia and retinopathy of prematurity. The blended air is then filtered using a reusable filter, which removes viruses and other pathogens. The gases are then humidified in a bubble humidifier to prevent the patient's airways from drying out. Now that the gases are blended, filtered, and humidified, they are ready for the patient to breathe through a pair of silicone binasal prongs. The gases then flow into the pressure generator, which generates pressure to keep the baby's lungs open. This can provide from 4 to 10 centimeters of water pressure, depending on the depth of the wand. The device can be seen bubbling, which means that it's working and the patient is receiving respiratory support. Vayu Bubble CPAP has been used in more than 20 countries. Here are some experiences from healthcare professionals from around the world.
Our use of ventilators has actually decreased, and even our use of surfactant in managing these infants has also gone down. These are the babies who were, prior to the introduction of the Vayu CPAP, were either manually bagged, ventilated because of the availability of ventilators, until they died. So the Vayu CPAP has really helped us a lot in the care of these small premature infants.
What I can advise other healthcare providers regarding the use of Vayu Bubble CPAP, this is something we in the lower middle income countries have been looking for. It's the device that does not require electricity, and therefore if in a facility that uses oxygen cylinder, the Vayu Bubble CPAP can be connected and offer the optimum support that is expected.
Before we had Vayu Bubble CPAP, we had a complex electronical device, which was hard to use. Only a few nurses knew how to use it well, and it was always a bit of a struggle to start a baby on CPAP. With the new Vayu Bubble CPAP device, it's so much easier because we all understand what we're doing, and we can understand the device because it's so easy and well organized.
The Vayu bCPAP system has been implemented across 25 hospitals in Ukraine to help save the lives of premature babies, even in frontline hospitals where there is no electricity. The war has caused extra stress on pregnant women, leading to an increase in the number of premature births, which has tripled in some areas. In partnership with Unitaid, Vayu donated critical respiratory support devices that have been used to treat over 1,000 Ukrainian babies in respiratory distress.
Системи Vayu Bubble CPAP важливі для наших пацієнтів. Вони дозволяють продовжити дихальну підтримку навіть в умовах бомбосховища, в інших пристосованих умовах. Ми маємо пацієнтів, які одужали і виписалися завдяки застосуванню Vayu Bubble CPAP. Тепер ми можемо поділитися досвідом з іншими медиками. Це ефективний пристрій, простий в користуванні, може використовуватися в будь-яких умовах при наявності джерела кисню.
The Vayu Bubble CPAP is designed to work in any setting, improving the health outcomes of infants suffering from respiratory distress around the world.